In Massachusetts certified sober living, every hour spent assembling compliance paperwork is an hour pulled away from your residence. Managing MASH certification by hand means policies, staff training, and outcome records all competing for the same hours. That is exactly the gap this new partnership is built to close across the Commonwealth of Massachusetts. The Massachusetts Alliance for Sober Housing and Behave Health are partnering to strengthen recovery housing operations and support statewide. So, who is MASH, and why does its certification carry weight? MASH is the Massachusetts state affiliate of the National Alliance for Recovery Residences, known as NARE. It certifies recovery housing providers across the Commonwealth against standards rooted in NARR's national framework. Those standards address safety, ethics, peer support, and operational accountability for the people rebuilding their lives in recovery. Here is what is at stake. Massachusetts has thousands transition from clinical treatment into recovery residences each year, and certification is the signal referral sources trust. Treatment centers, hospitals, and courts increasingly look to MASH-certified homes when deciding where to send people. But certification demands documented policies, staff training, outcome tracking, and regular reviews, work that manual systems turn into a constant drain. Purpose-built recovery housing software is changing how certified operators run day-to-day. Here are 4 areas where it makes a real difference. It replaces spreadsheets and paper logs with one operational system. 1. Bed management and census tracking. Tracking beds and census becomes streamlined through a digital platform rather than spreadsheets and paper logs. 2. Automated, audit-ready reporting. Instead of assembling compliance documentation by hand before each review cycle, operators generate reports directly from their operational data. That cuts preparation time and is designed to keep records consistent and audit-ready. 3. Client progress documentation. Resident milestones, house meeting participation, employment progress, and recovery plan adherence become systematic instead of ad hoc. Digital records give a clear timeline that supports both clinical decisions and compliance reporting. 4. Communication with referral sources. Secure messaging and structured data sharing replace fragmented phone calls and emails with treatment centers, case managers, and families. Better coordination is designed to build confidence among the referral partners you depend on. Here is the difference that matters. Rather than adapting generic property management or healthcare tools, operators get a platform built around the workflows of recovery residences. This partnership gives Massachusetts operators software designed for their specific needs, not a generic tool bent to fit. It is built around how recovery residences actually operate, so the system matches the job. For Massachusetts operators, the day-to-day payoff is concrete. Streamlined compliance workflows reduce the friction of maintaining MASH certification, so teams spend less time on paperwork and more supporting residents. Automated reminders for policy reviews, training renewals, and documentation deadlines help ensure nothing falls through the cracks. Consistent outcomes data strengthens your standing, the kind of evidence funders, agencies, and treatment partners value. Stop letting compliance paperwork pull you away from your residents. See the recovery housing platform built for MASH-certified operators and book a demo at behavehealth.com. See bed management, automated reporting, and outcomes tracking built for recovery residences. Book a demo at behavehealth.com.